My name is Farouk Jaffrey. I'm an emergency physician here at White Plains Hospital, and I run the simulation program for the emergency department. The training was fantastic. We had a lot of good responses in regards to the airway program that we're running. We focused on teaching difficult airway scenarios to our multidisciplinary, multi-professional staff. We had emergency physicians, ICU physicians, nurse practitioners, registered nurses, respiratory therapists, a very diverse group that came through our program, and our focus was really how do we work together as a team to manage a very difficult airway scenario and have it as smooth as possible. One thing that we've been looking for is a high quality task trainer, especially when it comes to surgical airways. It's not a very common procedure, which makes it even more important to be able to practice it so we have it right in the event that this really happens in a realistic environment or it happens in our clinical environment. The tech that we used today was the Lazarus 3D Confident Cric base. And what I loved about the model that we used today is not only can you use it on a table, but you could also incorporate it into a high fidelity simulation, which allows this very multidisciplinary interprofessional staff to walk through, navigate a difficult airway scenario, and then when they make that decision, to be able to perform that procedure on a simulated case and have that realistic environment. And I think that's really what puts this far beyond any of the task trainers I've used so far.
My name is Frank Quintero. I'm an emergency medicine physician at White Plains Hospital. The training and simulation went excellent today. I really had a lot of fun performing all these procedures with my colleagues, my nurses, my techs, my peers. It was extraordinary. I liked the Lazarus model as well because I was able to perform 2 techniques of surgical airway. I did a Celder technique that went well, and I did an open cricothyrotomy that also seemed to perform excellent.
I would consider today an absolute success. Our program was very well received. Our staff members left out with big smiles on their faces. Some of them asked if they could stay later and practice the model even longer, and I thought that was absolutely fantastic. So I'm excited about running this on a regular basis for our staff and being able to invite multiple different professionals to come and use our technology.